We have a lot of patients every day that come into our office that have been dealing with issues of tired, heavy, achy legs, night cramps, restless legs, discolored skin, ulcerations, non-healing wounds. And a lot of these patients have seen countless physicians before in the past. They've been given creams for their eczema. They've been told to wear compression stockings, or they've just been kind of written off because even a lot of the referring doctors didn't know about the newer techniques or what was available to help these patients. And so we get patients that come in that are finally referred to us or find us by themselves. And when we tell them they can treat us, some of them are a little skeptical. They say, I've been to a lot of different doctors before. Other people, nobody's told me about this before. Why are you the guy that's going to help me? And so I always tell them, look, trust me. I've heard this story lots of times before. This is the techniques that we can use. Here, how things have advanced. And a lot of times I'll say, we'll try one procedure and see how you feel, because a lot of times our treatment plan will actually require a few different procedures. And we'll have patients that come in, they get treated, they come back the following day, and they're already a true believer because they'll tell me, you treated your left leg yesterday, and it feels amazing. My right leg is still hurting me. And so just the drastic result and the very, the minimally invasive aspect of it, the fact that patients go home the same day, that they drive themselves there, drive themselves home, go right back to work, and it's really minimal disruption to their life, but you have drastic results. And so it's really, really rewarding for the patient and for us. The things that we're able to do now within the last really 5 to 7 years, before weren't available as an outpatient. You had to go into the hospital, you had to have open surgery, spend days to weeks in the hospital recovery time. The problem was that what really wasn't a good way to treat it. So we put patients in compression stockings, and that helps to compress the veins and to squeeze the blood back to the heart and to alleviate symptoms. The problem with it is that they're hard to get on, they're hard to get off, they're uncomfortable, they're hot, and they don't really fix the problem. They just slow the progression of the disease, and really, most people aren't really very compliant with it. And then the other thing to do is vein stripping. And vein stripping is an open surgical procedure that they use in the hospital under general anesthesia, where we insert a metal rod into the vein, and they literally just tear the vein out. And by doing that, it removes the vein, but it causes a lot of trauma to the leg and a lot of trauma to the surrounding area. You can get a lot of pain and bruising afterward, nerve damage, a lot of discomfort. The recovery time can be weeks to months. And patients usually spend a couple days in the hospital. Now what we're able to do is we go in using ultrasound guidance, and we'll put a small catheter inside the vein. And the catheter is about the size of a piece of spaghetti, and it goes inside the vein, and so the patient doesn't feel that. And then just a few little needle sticks we numb up around the vein, and then as opposed to physically removing the vein, the catheter heats up and we close the vein, and then we rely on your body's immune response to slowly dissolve that vein over time. It has the same effect, but it's much less traumatic. It's much less traumatic in the short term, meaning that you can drive yourself there, drive yourself home, go home the same day. But in the long term, whenever you would physically rip out the vein, your body would react to that trauma by forming lots of new veins. And so we have patients all the time that had vein stripping in the 70s and 80s come back to see us, and now their problems are worse than they were before. Because instead of having one large shallow vein in their leg that's dilated or stretched out and leaking, they have 10, 20, 30 of them that are now causing problems. And so the technology now, the idea is with our field is just less invasive, the least amount invasive as possible, meaning that we rely on your body to do the healing, and we just kind of stimulate it by closing down that vein and letting your body heal naturally, and you have a much better long-term result.